February is American Heart Month, and a new study suggests even a mild case of COVID-19 can lead to an increased risk for heart disease.
Western Mass News reporter Amanda Callahan is getting answers from a local cardiologist on the likelihood of developing cardiovascular problems after contracting the virus.
A new study suggests an increased risk of cardiovascular problems such as heart attack and stroke for patients who have had even a mild case of COVID-19.
Lungs plus existing heart disease equals difficulty pumping blood, heart failure, etc.
I spoke with Bay State cardiologist Dr. Adam Stern to see what patterns he's seeing in his patients here in Western Mass.
I think the thing I'm seeing most in terms of long COVID is, patients have scarred lungs and they need to get pulmonary treatment, pulmonary rehab, and they may also have residual heart failure.
Dr. Stern tells Western Mass News while the virus can create long-term health problems, the effects of the pandemic are making an even bigger impact on his patients.
One thing I've seen anecdotally in the office and what's also been reported in studies is really issues with weight gain, with increased blood pressure through no fault of the patient themselves, but just because they are isolated, they have been taking precautions the way they've been advised to.
He also adds that the strain put on emergency departments, coupled with the decline in elective care, may be leaving people to ignore important cardiac issues.
Patients were probably less likely to come into the hospital or seek out care for their chronic heart failure. They have gradually accumulated fluid, understandably being wary of coming into the hospital or seeking care.
However, Stern says if you have recovered from the coronavirus and are not suffering from acute issues, there is no need to worry.
I think a year out, from your initial COVID diagnosis, if you're feeling well from a heart standpoint, I don't think there's any evidence to point to the fact that you may have sequelae at that point. I mean, I guess we'll continue to see. We're still building data on all of this.
Amanda Callahan, Western Mass News.